Hey, ClaimTek team. So I'm coming to you today to talk to you about COVID-19. You know, the coronavirus has quarantined us all. And a lot of people are concerned, how is this affecting my business? How is this affecting doctors' businesses? Can I be marketing to them? Should I be? Aren't they overwhelmed? And the answer is yes, you should be marketing. Absolutely, you should be. This is one of the best times for you to be growing your business and making connections. And the biggest thing that you can be doing right now is reaching out to doctors and letting them know that you have the resources that can get them over this type of a hump. You know, this is a big wake-up call for a lot of doctors. You know, a lot of doctors, they pedal through things a lot of the times. They understand they have things that they could improve upon, but they don't always do it until something happens. And I'll tell you what, folks, it is happening right now. Doctors are under the gun. They are in crunch time, and they are pedaling a million miles a minute to try to figure out how are they going to handle all of these new tests, all the new patient influxes. How are they going to be able to make up their money from some of the elective procedures or surgeries that they were maybe going to be doing? How are they going to make up and become more efficient in the latter part of the year to make up for the downtime that they had in the beginning stages of this year? So 2020 is going to be a big year for us. So don't let it pass you by. Don't sit home and don't stay idle. You can sit home, just don't stay idle. As you're staying at home, make your phone calls, read about articles, read about changes. We're putting out a lot of information about things that are happening in the industry. What is the coronavirus doing to doctors? Well, it's overwhelming their clinical staff, and it's really hard for them to focus on the administration and the nuances of the new red tape that they're dealing with when they've got sick patients in front of them, and when these sick patients can be very contagious. So they need to really worry about the people that they're seeing in their office. Not only that, but some doctors are limiting their staff in their office. Individuals could be potentially getting sick where they're not limiting their staff because they want to, they're limiting that staff because they have to. And so how you can step in, not necessarily, stepping in as a staffing company, but stepping in as a practice management firm that can provide the resources necessary, to cover problems when they occur. So this is what you really want to be doing when you're marketing, positioning yourself as a professional practice problem solver, letting doctors know that you've got problems that I can solve, that you're working with a team of billing professionals that have seen all of the changes that have come throughout this industry in the past 2.5 decades, and that you are ready to tackle this one for the doctors, help them solve their problems, help them improve that efficiency in their practice so they can really get back to what they went to school for, to what they got into business to do, and that is practice medicine and provide quality patient care. So we're going to focus on the money, they focus on the medicine. And that's what it's all about, guys. So I hope this video has helped to encourage you to keep making those phone calls, keep reaching out, letting those doctors in your area know that they have a resource that they can rely on. This is really important, team. You've got to make sure that the people in your area know you exist, or they're never going to call you. So if you've been waiting, if you've been nervous, if you've been holding off on making those phone calls, pick up the phone. The time is now. Don't delay. Do it today. Make 20, 25, 50, 55, 500. Make as many calls as you possibly can over the next 5 to 10 weeks, because we are at a place we haven't seen before. We've never had to go into quarantine like this before in the United States or around the world. So this is creating big waves in the healthcare industry. There are a lot of changes that are happening. We have a doctor shortage. Florida, they just released a new bill. It was passed where they are allowing nurse practitioners to start opening up their own practices without a primary care physician in that office. So doctor shortages are creating more opportunities for us as medical billing companies. Okay. We also have things like telehealth. Telemedicine is becoming really big. We can do all of the billing for telehealth and telemedicine. We can make sure the doctors are prepared and ready for it so they get paid for it, because it's one thing to provide telemedicine. It's another thing to actually get paid for it. And there are some specific things that they have to do to be able to get paid for it. So I just wanted to come to you here quickly today to wish you all well. I honestly hope that you and your families are doing well, that you're protecting yourself, that you're taking precautions. But I also want to make sure that you're not letting this time go to waste. Use it to your advantage. All right. Pick up the phone, make the calls, do the outreach, spend time online, learn more about your social media, learn more about LinkedIn and Alignable, make connections with new individuals out there, create some referral networks. There's a great time where, pharmaceutical reps, medical device sales reps, accountants and lawyers, they're not meeting with people all of the time like they used to, like they always do. So what's a great way? Do the outreach now while they have a little downtime, while they have a little more freedom. They're not, in front of people every single day on meetings. So try to get on some telephone meetings. Use Zoom. Guys, if you're making phone calls and you don't know how to get with a doctor on a meeting, learn how to use the Zoom app, Zoom, or TeamViewer, or GoToMeeting, or WebEx, or JoinMe. Any of these applications can work really well for you. I just like Zoom. I think they make it very easy. You can actually record Zoom calls. You can actually connect your computer screen through Zoom calls as well. So if you have a meeting with the doctor, you don't have to travel to their office, or if you're trying to meet with doctors out of your area, this would be a great opportunity to start calling anywhere. If you feel like you've exhausted some of the doctors in your local area, start calling abroad, because if you couldn't meet with them in their office anyway, it doesn't matter whether you're meeting with them, on a Zoom meeting or face-to-face in their office. You can have this face-to-face. I'm actually recording this right now through Zoom. So take some of these tips and tricks and put them to use. Get out there, make your phone calls, make sure you're posting information, stay up to date with the COVID-19 info, make sure that you're aware of things that are coming across. Like, for instance, the Trump administration, opening up Medicare benefits to cover this COVID-19 outbreak on telehealth. There was a lot of things that they needed to be approved for before applying for telehealth. Right now, Medicare has taken those things off of the regulations. So they've opened up some doors for doctors to take advantage of. If they jump into it now, they're going to be a lot more prone to doing it. After all of this is done, they can keep doing it, and they can start generating new revenue streams through telehealth. So great opportunities out there, guys. I hope you take this and go out there and use it. All right. There's a lot of things that you can be doing. Just fill yourself up with that energy, make yourself vibrate, get on the phone, and start pounding those calls. All right. We'll see you at the top. Stay safe.